Hello, everybody. Good morning or afternoon, wherever you're joining us from. My name is Katie, and I'm filling in today for our usual host, Matt, who is out on PTO. We have switched all of our webinars over to Zoom, so please go ahead and use that Q&A section to interact with us during this session. We do have all of you guys on mute, but we'll be watching that area for your questions. To start, I want to say thank you for spending some time with Provider Trust today. We really hope that you enjoy this session. Our topic today is, there we go, health plans and COVID-19, understanding risk in the year ahead. So just real quick, if you don't know much about Provider Trust, we are a software as a service company here in Nashville, Tennessee. We serve healthcare organizations, both right here and across the nation. We really believe that a smarter healthcare makes a safer healthcare. And this belief is really what powers our work to monitor healthcare populations, to identify compliance and credential issues before they impact patients. Just a quick note, after today's session, you will be getting an email with a link to the recording and the deck, which you are more than welcome to share with your colleagues and team members. Our presenter today is Dave Servodidio, our Director of Marketing. Dave also has experience leading our health plan segment and has helped us create solutions that are really tailored to the needs of health plans and how your organizations work. Dave, what are we going to be covering today?
Awesome. Thanks, Katie. We are super excited for today's session. It's a quick one, a good little 30 minutes to go, but we've got some good stuff planned. So today's agenda that you can see on your screen, we're really going to cover three things. It's one, it's understanding what has changed in light of COVID. It's secondly is knowing the new areas of risk. So part of what we do, Katie mentioned it, but part of what we do is understanding risk profiles and risk mitigation for healthcare providers and for plans, and understanding what's sort of cropped up and what's a new emerging area of risk as we all navigate COVID-19. And then lastly, we'll close with some best practices, is to say there's a lot happening in the world today, and how can we best mitigate, and what's something that you might be able to do today as a takeaway. The other thing I think it's worth saying out loud is we talk a lot about being human at Provider Trust, and there's a lot happening in the world today. We're all navigating a global pandemic. We are navigating just racial tensions being just at just incredibly high levels in this country. We're navigating a recession, and certainly the impact that has in healthcare as well. And so from us to you, our hearts go out to wherever you are today. We're here for whatever you need. Part of I lead our marketing team at Provider Trust. We've gotten feedback from all kinds of organizations in healthcare saying, what would be most helpful in this time? And we've positioned ourselves as to say, gosh, we intentionally try to stay a little bit quieter as a brand, but that when we have something to share of value and we have something that we think could be helpful, how can we be of service to you and your organization? So that's the driving force behind this session today, is that we hope it can be useful. We hope we can serve you well, and we can just love you well today, because this is a time where we're all dealing with our own individuals' circumstances and story. So we appreciate your 30 minutes. With that, we are going to kick it off, I believe, with a quick question, just to get some early engagement from folks. So Katie, take it away.
Yeah, we are. So at Provider Trust, we love to say, if you've seen one healthcare organization, you've seen one. So we're really curious, at your organization, which department or function really owns that provider network management and monitoring? Is that your provider network and operations, credentialing, IS or IT, compliance, payment integrity or SIU? Perhaps there's no clear owner, or maybe you have somebody owning this who we haven't even thought of.
And so we'll give it another couple seconds for y'all to fill in, but this is a sneak peek ahead of what certainly we have a bias towards this because it's some of the work that we do, but some of the things that we'll talk about have to deal with network integrity and how to understand your data practices and data management and the impacts that can have in light of COVID, what's changed and what's happening. So just as a baseline, it'd be really interesting to see kind of where we net out with all the folks on the phone, and there's quite a few of you today. So again, thanks for joining. let's go ahead and close that out. And I believe that we can share results as well to get a look at this. And overwhelmingly, the folks on the phone is provider network and provider operations that really go through the management and the monitoring of the provider network. We see a chunk of those in compliance as well. And interestingly, we see not a lot with other folks. We've got several clients and organizations that we talk to on an individual basis, and we have seen all of these departments that own this activity. So it's interesting to see that we really only have 2 represented today from y'all's organizations, but it's good to know. So awesome, that gives us a great baseline. So with that, let's dive in to today's session. So COVID-19. COVID-19, gosh, is we all know it's an unprecedented time. We could, as everyone else is doing today in healthcare as well, I could go on for hours about the impact that it has on healthcare, care delivery, some of the shifts that are taking place both in the short term and what we think will be sticky for the long term. Today, we're going to focus really the impact through the lens of health insurance and for payers, and understanding the impact that COVID-19 has for y'all on the phone, and really laser focusing on that. So within that lens, let's get rolling. So challenges facing health plans. Here is what we hear from the marketplace, from our clients, from people that we talk to, as what folks are dealing with right now and trying to understand how to mitigate a lot of these challenges right now. There are more than are on this list, and we certainly understand that. We certainly know that. But these 6 seem to be, from our lens, what continues to pop up time and time again in every conversation that we've had, frankly, over the last 6 months, as we're all navigating some of this. Going back, just reading through these is increased coverage for COVID-19, rapid expansion of telehealth, and we're going to get into each of these in a minute. Delays in payments of premiums and policy cancellations, as you guys may see. Negative impacts to population health, interstate licensure portability, understanding the impact that has, and overall financial impact on operations. And digging in deeper, we do see the reason why we're focusing on these 6 today is we do see some unique common threads that actually can thread all 6 of these together. So our goal is to say what small tactical changes might have a large impact. And some of these challenges we actually see and have seen health plans deploy small tactical changes that have had a material impact on all 6 of these. And so I'm excited to go through a little bit of that today with you and share a little bit more. So let's dig a little bit deeper so we can anchor to what we mean. Increased coverage for COVID-19. So no secret, we have been tracking along as all of us really stay focused on how we can best serve our members, how we can best serve patients. What does that look like in this time? And so certainly many of the plans, we've been able to look at the plans that are represented on the call today. And we know that many of y'all's plans have launched COVID-19 testing at no cost to members, certainly have gone through waived pre-authorizations to make sure that we can rapidly provide testing. And what we have seen is a pretty quick expansion of government line of businesses. So government programs, Medicaid, Medicare, even within Medicare Advantage plans, we've seen those member bases increase as some folks in this country are losing their policy, losing their plan, and going on to a government-sponsored line of business. So that's been a big part of the dialogue, is understanding what management practices we can put in place for government line of businesses as well that really touch CMS dollars. Secondly, going a little bit deeper is telehealth. Telehealth is here to stay, friends, but specifically to anchor to today is just increasing provider capacity and increasing your provider network. Telehealth allows providers, as you well know, to increase their capacity to serve patients. And it's also allowing for providers to enter your network that otherwise may not have, specifically talking about non-PARs as well, your non-PAR member base, and how they can come into your plan and really become your responsibility, depending on where you sit within the organization. Adoption beyond COVID-19. Rapid adoption, rapid provider credentialing, and what does that look like in the healthcare landscape too? We have seen part of what we do as a business is we help manage and monitor provider networks. And so as we've been helping health plans do that, we have seen the influx of providers that and the claims come in that are COVID specific to try to expand service to members. But that said, every plan that we've talked to says that this is a trend that's here to stay. So how can we put in practices that both help us now and also help us build for the long term? And then reducing the cost of claims over time, right? So patients' increased familiarity with this will likely broaden the acceptance of routine services. So how can telehealth just become part of standard operating procedure? Thirdly, we will talk about delays in payments of premiums just a little bit. So state legislation and just relaxing payment guidelines. We've seen that quite a bit. Creating the cash crunch during COVID. And so the reduce cash inflows during a period where payers and y'all are trying to accelerate claim payments to providers, and at the same time are seeing policies get dropped. And something like that creates this cash crunch. And so what's a small tactical improvement that may actually help from a profitability perspective? And then policy cancellations burden the healthcare system as well. We know this, this is known, but certainly some strategies that can help fight back against the impacts of that. Impacts to population health. As a business, we talk a lot about data, we talk a lot about monitoring. We rarely talk about population health, but as we all navigate COVID-19, we are seeing the trend between provider networks and provider operations and the impacts downstream that has to population health. And so we know that top of mind right now is big in investing in social determinants of health to keep communities healthy, delivering interventions to vulnerable populations, not dissimilar to a lot of the headlines that we see in the news these days of inequities in healthcare and how certain populations are disproportionately affected by what's happening in the United States. And then addressing the impacts of deferred care, this is a big one. So the provider systems that we talked to, I'll give you an example, is we talked to somebody from Vanderbilt very recently who works in population health. And their current operating procedure is to meet multiple times a week with all of their plans, all of the payers, to understand how to proactively communicate to patients that may need to come in so that the impacts of deferred care don't linger and don't create downstream negative impacts, both for the patient and for the system as a whole. Licensure portability, this is a big one for us. So how do you ensure provider eligibility given the fact that a lot of the rules just changed? Managing and monitoring provider data, what does that look like, and how does licensure and licensure portability actually roll up into an automated ongoing strategy? Verifying licenses at the primary source. Now more than ever, for a number of different use cases, we are seeing the importance of needing to verify licenses at the primary source. How do you do that in a scalable way that allows your organization to serve patients really effectively, efficiently, and safely? So I've spent a lot of time there. I wanted to breeze through that relatively quickly to anchor on a lot of the pain points that we hear from the health plans that we talk to pretty consistently, so that we can really get into understanding what risk that those problems create, and then understanding how best to mitigate that with short-term and long-term strategies. And so understanding new areas of risk, we're going to anchor to 6 things in this session that we continuously hear from the health plan market as a result of COVID-19. Changes to licensure portability make it hard to ensure provider eligibility in real time. I'll give you a real example of this. Is we are seeing an influx right now of medical volunteers that are traveling from out of state to places that need help in response to COVID-19. We saw this acutely in New York and acutely in California. We also see it to a lesser degree, a significantly lesser degree in other parts of the country. But we've seen medical volunteers travel out of state. We've seen medical volunteers come out of retirement to help and try to rejoin the workforce. Licensure portability, and given the fact that so many of those rules have been either short-term relaxed or long-term relaxed, makes it really hard to determine, does this professional have a license, yes or no? There's a really interesting article and really interesting research in the New York Times recently that talked about the influx of medical volunteers that reached out to serve the state of California in response to COVID-19, and how roughly 80% of those lacked the one basic thing that they needed to be able to be put on the floor of an emergency room, which was a medical license, right? So how can you ensure that these providers are eligible to keep your patients safe? Challenges in collecting ownership information. The sad part of our business is that where crisis goes, fraud typically follows. And we've already started to see it. We have already started to see billing fraud. We've started to see vendor fraud in the supply chain. And we've seen a lot of umbrella companies that fraudulent providers tend to create to continue to bill, specifically and try to sneak in through the non-PAR network and submit a claim that way. We are seeing that. That is something that we actually respond and see to every day. But it's a thing that ownership information, understanding a successful process for how do you collect, monitor, and screen that on an ongoing basis is critical to understand how to really effectively prevent fraud. An expanded provider network, particularly non-PARs, invites potential fraud, waste, and abuse and ineligibility. We'll touch on non-PARs as just an example of, as a result of COVID, we know that managing your non-PAR network and non-PAR claims that come in is a challenge, and that opens the door for new aspects of fraud. Social determinants of health and fraud, waste, and abuse patterns, they indicate new risk patterns for vulnerable populations, and specifically people of color. We've seen this quite a bit. We also are seeing the tie between who do fraudulent providers actually treat from a beneficiary or a member perspective. What's the demographic profile of those individuals? That storyline, there's really impactful research that came out of Johns Hopkins towards about the middle of last year that analyzed who is the patient profile, what does that look like, who's the patient that an excluded provider treats. And what we see is that patient is more likely than not to be non-white, they're more likely than not to be disabled, they're more likely than not to have some sort of chronic illness, they're more likely than not to be under 65. And understanding the fraud propensity and understanding social determinants of health, there's a significant statistical relationship between the two. Just sheer profitability and understanding how to manage cash flow and what does that look like. Depending on where you sit in your organization, this may be directly your responsibility or indirectly your responsibility, but it's certainly a topic that we hear quite a bit about. And then the last one here is social isolation and deferred care are anticipated to negatively impact population health and drive up costs. So the cost of deferred care for those that are putting off elective surgeries or any other type of care simply out of fear for entering their provider organization. And then the effects of social isolation, which has been linked to, the effects of loneliness has been linked to the equivalent of smoking 15 cigarettes a day for years, right? And so understanding the health outcomes that are associated with that, how can we implement practices where we sit in the organization to actually help those folks that need it most? So understanding those areas of risk, we will now just dig into a poll question. And Katie, I'll ask you to lead this.
Yeah, all right, so let's check in here. COVID-19 has led to new areas of risk, as we've just talked about, for health plans. So we want to know which of these are you and your team most focused on in the immediate short term. So we'll call that the next 3 to 6 months. Are you concerned about managing license portability, collecting ownership disclosure information, managing that cash influx and profitability, managing your non-PAR provider networks, population health impacts due to deferred care, or social determinant of health disparities and inequities? Give us a couple more seconds.
And I know that, friends, we are all focused on all of these. This is, and it's a big part of what the conversations that we try to have from where we sit in the healthcare landscape. I think we're really just getting a sense of knowing that there's a lot of folks on the phone today that touch providers in some way, shape, or form. Provider data, provider relations, credentialing, compliance, and then leadership of health plans. We're really interested to say what's most top of mind for you guys. So we will close that out and go ahead and share the results and kind of see what came back. And really interesting here. So 44% of the folks on the phone said that managing licensure portability and understanding what that looks like in a health plan landscape was the priority most focused on. 22% were managing non-PAR networks. 22% were population health impacts due to deferred care. And then 1% is cash influx and profitability. Super insightful, friends. Thanks for submitting your answers. And so with that, we will dig a little deeper into some of this. Here is what we have seen. So I alluded to this a while back, which is there a common thread or a common theme that we see that maybe small tactical changes can have a significant impact? That answer from our perspective is yes. We think and we have seen to be effective that a key to risk mitigation is in provider network monitoring and what goes into that. And we will talk about what that means specifically. I think it's worth saying that as a business, I work for a business called Provider Trust. Provider Trust in our history started off in compliance monitoring, right, and checking lists on a monthly basis. But as we've evolved sort of our view and our vision, we realize that if you can understand how to effectively monitor a network for a health plan, the impacts that can have both to patients and downstream operations for a health plan, and what does good look like? And it's a question that we constantly redefine ourselves internally, but we're also seeing it be defined externally, which is a lot of what I'll talk about today. So understanding that view, right, here's what we anchor to in the provider ecosystem. So when we say provider network, we really understand the life cycle of a provider. And so when it goes from enrollment, and for the folks on the phone, if you've been to a webinar with us before, this is probably a slide you've seen. If you haven't been to a webinar with us before, this is just a quick snapshot and a quick overview of what you already know, which is the life cycle of a provider. And so from enrollment, we go to contracting, we then go into credentialing and re-credentialing, then to become part of the provider network that is in network, and your participating providers. You then, certainly those participating providers submit claims and go through that process, and then you have SIU just in case something goes wrong and you need to go into recoveries or address leakage in any way. That comes up in your SIU compliance department on the back end, and then you start the cycle over again and re-credential the provider and go through that. Non-PARs are a little odd though, and we've seen every health plan that we've talked to has managed non-PAR management a little bit differently too. Non-PARs typically skip some of the processes and come into your network. And the reason why I'm bringing that up at this point in the presentation is that when we bring this up, we realize that non-PARs really represents a significant risk if not really thought about appropriately and not managed appropriately. Why monitoring matters, right? Member service, expectation of access, keeping members safe, and then internal and external reasons why it matters as well. A clear picture of your network, both PAR and non-PAR, increased efficiency and cut recoupment costs. And then externally, it's just ensure compliance for Medicare Advantage, Medicaid plans, and contractual obligations. So the risk in monitoring, right? And then we'll go back to risks as COVID. The risk that we see in monitoring is payment integrity risk, provider operations risk, and the patient safety risk. Right, so we see all of these come up. If looking at in the life cycle of a provider, where is our true risk, and understanding where that goes. But if I take this a step further and anchor back to the 6 sort of risk areas that are new from COVID-19, right? If I take these 6 and say, gosh, is there a common theme that might actually connect and address some of this? We believe there is, which is smarter provider network monitoring. And how to do that. And now I'm going to explain what we actually mean when understanding some of those risks. And so best practices for mitigating risk and thinking about this through the lens of your provider network. We know the challenges with this, right? So staying on top of licensure portability to ensure billing eligibility is an overwhelming task during COVID. Due to telehealth expansion, we have seen non-PAR volumes just become overwhelming, up to 10 times what we see was a traditional PAR network. We've seen this be just a new influx of risk profiling. We know that non-PARs are a dynamic population and difficult to track. And then just looking at provider data that's both participating and non-participating, we know that disparate provider data typically exists in various systems, departments, and lines of businesses as well. Variations in systems lead to multiple points of entry for providers that increases risk profiling. Collection and monitoring of ownership data is a difficult task. And then there's a common knowledge of a lot of these issues, but no home for ownership and therefore no solve. Here's where we typically see provider monitoring, addressing the ownership piece of this and whose responsibility is this. We see these departments, right? Everybody from provider ops, credentialing, compliance and risk, payment integrity and claims, to the CMS lines of businesses and those folks responsible for those business lines, Medicare Advantage, Medicare, Medicaid, and then within information sources and information systems is claims processing system, your CRN, if you use Salesforce, your credentialing platform, your primary sources directly. All of these impact the movement, management, monitoring, and risk of your provider network. And so all are critical to include when understanding the risk profile and the solve. Here are some of the issues that we see is data issue one, I mentioned this, but disparate inconsistency in data. What we have found is that if you start with NPI as the unique identifier of a provider and you start to go to different sources, what you find is that there is a common thread in your NPI number, but the disparate nature of the sources around that make it really hard to find everything all in one spot, even internally at your own organization and certainly externally at a primary source. So at a primary source, you may see one of these, but you may not see all. So how are you building network strategies that keep NPI at the center, but allow you to expand and build what we would call provider profiles? And how do you understand your provider data? And so the second issue is primary sources, which is how do you take the data that you have and does it match up and how well to a primary source? And so what you're looking at here on the screen is the differences in what would come up with a health plan in a primary source, which is where some of those missing pieces end up being. And in this example, you have an NPI, right? It's the same organization, but on a primary source, which in this case happens to be exclusion list, the data is very different. So how do you take the profile that you've created from a network strategy and actually link that to different primary sources at the time that you need it most? And then moving forward is just a real snapshot of a primary source and how messy it can be. You guys know that if you deal with provider network data, you know how interesting it can be to actually pull primary sources together to even build a profile. Steps to solving the problem. And some of the things that we would recommend doing is, right, if we understand and take a hard look at the risk areas that we see in all of those, we see the provider network as being a critical thread through all 6 of those risk areas. And so addressing your provider data is part of the problem that we see. And so what we would recommend as a first practice, and I'll explain why and how with really tactical handouts and things that you can take away, is the first is define ownership. Who owns this? Second is establishing best practices. Third is eliminate manual verification in any practice that you have. And then 4 is integration and understanding a provider data strategy that integrates at time of care. The real life scenario there is that you don't want a non-par provider to submit a claim that happens to be fraudulent and you find out later. How can you integrate data into your workflow so you can find out at time of claim that you should not pay this claim to this provider to keep your patient safe, right? How do you know that in real time? And so here's just a magnitude of this, right? And the next tactical, practical steps. Step 1 is define your standard operating process and procedure. We talk 3 things. When we talk about provider networks, we talk about criteria, scope, and frequency, right? Criteria, scope, and frequency. And understanding how to build a monitoring strategy that allows your provider data to really keep its integrity high, you have to address these 3 things. And so the example that you see right on the screen is at time of claim, and as you're building your profile, out, what do you actually qualify as your provider network, right? If you're looking at that claim, and this is specific to a non-par as an example, is at time of transaction, if you go out 12 months, if you go out 24 months, and if you go out sort of forever, we've seen sort of everything in between in how folks actually describe what even makes it in there. So what's your criteria, what's your scope, and what's your frequency to build your provider data strategy? The second slide that you'll see here is build your matrix, right? We have seen health plans start to take on this process as a checklist type approach. And the holes that you find in the first go around are dramatic, right? Is what we've seen. And so for each of your populations, right, and as it relates to COVID especially, put all of your populations on the left. Put all of the pain points that you need to include in a monitoring strategy through any population on the top, and then start to check off, right? What does my scope, criteria, and frequency look like by each type of line of business or each population? And how do you build an effective monitoring matrix that allows you to really, at a glance, understand your provider data strategy, which then allows you to go back and help address some of the risk profiles that you see as we're all navigating COVID. And then lastly, it can become really overwhelming to do so. I'm not going to read some of the things here on the slide, but certainly there are partners that may help you integrate this into other places in your workflow. Certainly we include ourselves in that, but here's a checklist for if you go through the process of selecting a partner, how do you do so, and how do you take the data points that actually are most relevant? But I would encourage you, before you do this, is to do that monitoring matrix and understand where are my gaps and where are my risks, looking at this in light of COVID to say, how can we manage for the long term, which is a provider data strategy that helps keep patients safe and helps keep our health plan operating efficiently. Here's just a quick case study, and I'll just click through the whole thing. Ineligibility is a topic that we talk about a lot. And the reality is claims are expensive. And so we did a case study. You will see this because you'll get a copy of the slides. We did do a case study on a network of non-PARs that were about 150,000 providers from 2 states from a health plan that was a partner of ours. And what we found is we found 3,000 just at first screen instantly. We found 3,000 providers and 14 million in claims that we found with a quick scrub. And those ranged from inactive NPIs to opt-out hits to invalid NPIs to excluded providers. What you see on this screen is if you take the exclusion angle and you really run that out, some of the exclusions you can find at a primary source, and some are only found if you have a smarter provider data strategy in place and are building profiles. And so we went through a couple of examples about what primary source gaps could look like. If you don't have a strategy behind the scenes to connect primary source data to actually build an internal profile of a provider, you will miss things. We see it all the time. We see about anywhere between 1/3 to 50% providers that we see on a non-PAR perspective. We see those as not being found directly in a primary source without some sort of internal data enhancement strategy. And so smarter provider network monitoring is the key to fighting fraud, as so many different new areas of risk are popping up. The last thing is we do have an offer for anybody today that's interested, and this is no pressure, but for those on the call, we are offering a one-time no-cost scrub of your network or of your COVID-19 claims, and using the ICD-10 codes to do so. We do this every now and then for our partners, but we recognize I started the call by saying we are here to serve if we can. And if it's helpful, we are here to serve now. And if this is something that you or your team would find some value in, we'd love to be able to help. And that's totally no pressure. It's just a matter of if we can. Couple of last thing is that we do, I'll go salesy for 10 seconds, is we do have a new innovation. We launched a new product this year that helps to monitor provider networks and helps to do a lot of this work. If that's something of interest, just reach out. This is not a sales presentation. This is meant to be educational. So, but if there is an interest there, we'd love to talk to you. We will sort of bring it back online for questions. Friends, we did have 5 or 6 come in. I promised this would be a 30-minute session, and it is 12:33. So in the interest of time, we may have to cut it off, but I promise you, if you were one of the folks that submitted a question, we will reach out to you as soon as we can, and we'll coordinate internally to make sure the right person can reach out with the right answer to your questions, and we'll go from there, so that I don't take up any more time from your day. So Katie, bring us home.
Yeah, thanks, Dave. Thank you guys, everybody, for joining us. Please remember to fill out the survey that will populate at the close of this session. Your answers to these questions really help us to build useful resources and education. We take that really seriously. Also, remember to watch your email for a link to the recording and the slides. We would love for you to pass that on. as however is useful to you. Thank you, Dave, for bringing this material together, and have a great day, everybody.
Thanks, friends. Enjoy the day.